My name is Elena Semino. I'm a professor of linguistics at the University of Lancaster, and I direct the Center for Corpus Approaches to Social Science, which is the sponsor of today's event. I should join everyone else in thanking the organizers. This has been a fantastic experience for me. Now, I think some of you have been waiting for this all day, the announcement of the theme of the next event, the 8th in the series, and another colleague of mine from Lancaster, Tony McEnery, is going to tell you about that.
Actually, in many ways, I don't think the next theme will surprise you, because we've heard it again and again and again today. What we'll be looking at next time is the governance of global health. So that will be the theme, global health. Many times today we've heard global health covered as an issue for obvious reasons. Also in conversation over wine, I've had conversations about how actually things like climate change are very similar in terms of the challenges that it brings to issues like global health. It's an issue where no one country can solve the issue. We need to work together in order to address some of these pressing issues. And it's not just about COVID, of course. There are a whole range of issues in global health that are important. And of course, China is an interesting, dynamic economy, is also engaging with health issues that are perhaps familiar in the West, but in new ways. So if you think about the rise of instances of cancer, or instances of dementia in China, the negative effects, if you like, of an aging society, a society which is now beginning to age, those are interesting questions too, because we see some of these issues, which we might think are global human issues, actually play out slightly differently in different societies as those societies engage with those mortalities. So that will be the theme of the next dialogue. I'm thoroughly looking forward to it, and I hope you all come along and make a contribution, because as we heard today, the more we talk, the better things are, and these are really existential issues again that we'll be discussing at the vital and important forum that is the Global China Dialogue. So thank you very much, and come along.
Right, and the program tells me that we've got another perspective on the next event from Professor Nora and Colton.
So thank you very much. It's really great to be here, and it's a pleasure to really be able to help launch this next topic, which is the governance of global health. So I'd just like to take a few minutes and really talk about that, because that dialogue and theme is going to be co-organized by the school that I direct at UCL, which is the Global Business School for Health. And it's the first business school in the world totally dedicated to health. And we're quite excited about what that means and how that translates across cultures and societies. So it could not be a more timely topic as we see the challenges of global health. As we just heard, and health governance today has been very challenged over the last 2 years, as we've witnessed the world really struggling with containing COVID-19, alongside exposing many weaknesses in our health systems and governance as well. The pandemic has really caused health systems to scramble for access to vaccines, and we've seen wealthier countries buy those vaccines and lower income countries do without. The World Health Organization struggles constantly and calls for equity in vaccine access. So moreover, we've also come to appreciate the impact social determinants of health have on individual health and cohorts of our population that have witnessed a deterioration in many countries. So consequently, alongside coping with the pandemic, we see that failure to address climate change, as was just noted, the global prevalence of non-communicable diseases, inadequate access to health care services, and the lack of health workers globally are issues that cannot be addressed by one country. But they really require a global governance system to manage effectively. Yet the past 2 years, sadly, have reminded us that we still have inadequate global cooperation, and inefficient global institutions, rules, and collective action when it comes to health. The questions about global health governance effectiveness are not new. Every time we have a health crisis, they are highlighted. Yet the stakeholders who make up our global health governance system and community and oversight, they have evolved. Today, we don't just think of the World Health Organization. We have growing influence of philanthropists, such as the Gates Foundation. They have views and they impact on global health, as well as policymakers and activists. And moreover, global health governance includes new legal environments, public-private partnerships, financial markets, intergovernmental organizations, charities, multinationals, and the great involvement of our non-governmental organizations. So although the increase in the actors are welcome, all these various groups that now contribute to global health governance create a complex agenda, and with multiple layers, addressing global health problems in different ways, with different views, divergent processes, and also principles. The concern is that these competing global health players can create suboptimal outcomes for population health. The defeats of our current global health governance system may fail to prevent health problems from becoming global dangers. It may not be producing effective responses to global health. So the Global China Dialogue is a great place to explore these challenges and opportunities. China has an aging population, continued economic growth, but more importantly, a desire to reimagine healthcare management and governance. The Healthy China 2030 strategy emphasizes the need to develop the health sector in China. Like much of the world, China is seeing an increased expenditure on healthcare. In 2020, it's estimated that $1.1 trillion was spent on healthcare, which is about 7% of the Chinese GDP. China has also seen significant regulatory reforms in the health sector, alongside the need to think more about healthcare in a new global governance framework that sees global health as one of the most critical issues to be addressed with the engagement of a wide variety of stakeholders. Consequently, the next Global China Dialogue topic is extremely important and timely, and I really look forward to having the UCL Global Business School for Health being a co-organizer. Thank you.